My name is Jai Haku. I'm a corporate officer for Horiba Limited overall. Then I also manage all of Americas and Europe medical segment, and I'm the chairman of Horiba India. It's very fascinating these days, and I'm sure you will understand that. The key thing is now remote connectivity, because the next step in the healthcare will be that you will have monitors, electronic sensors at your home, and the doctors will know proactively what's going on. For example, the diabetic people, and you must have seen that people can have a continuous monitoring. That's monitored by doctor's office. So there is no point, not any point people will get a big shock or get a stroke. There will be some predictive messages sent ahead of time. So the big data is going to be very important, just like in any other field. So that part in medical is much more important. So devices we make in future will have the Wi-Fi connectivity, Bluetooth, so that they can talk to the central location. So you don't have to go to the doctor's office to find what happened. You can do it by your phone. So those trends are emerging, and emerging. Everybody, not only Horiba, it will be the trend. So that people staying at home can be monitored remotely, and that will increase the healthcare market. People get sick, no matter a poor country or a healthy. So our job is to reduce the cost per test, so that we can reach. My interest in India is, I want to reach every village and every corner of India. That's why we are investing in Nagpur, because it's almost mile zero, so that we can go everywhere. We have about 12 acres of land, and the building is being built right now as we speak, only for medical. And the idea is to reach every place at the affordable cost. Yes, we want to make money out of that, but the more goal is to help the society, and we would like to be part of that. Right now, it's different in different parts of the world. Like Mr. Horiba told you earlier, Horiba is not the biggest in healthcare. There are many other big companies. But what Horiba has, they have the analyzers right from the founder, Mr. Horiba's dad, who founded it, Dr. Horiba. They started with analyzers. So if you look at this broad cross section of Horiba, there's a common thing called analyzers. Like you do emission for cars, analyzing the particles. Healthcare, you're analyzing the blood. On the pollution, you're analyzing the particles. Same thing for scientific, looking at the particles. So it has a tremendous knowledge on the analyzing. So we are focusing on that part of the healthcare, not everything else. Like there are Siemens and everybody else. To give you an example, we introduced called the Hilo product for healthcare, which is a track system. It was introduced 2-3 months back in India. That one, Siemens has accepted that as a standard part, and they will be using our part worldwide. So it's not only what we do, what we can do with others, but the analyzing is the key part. I started this Horiba India Healthcare one 8-9 years back, I don't know exactly time, and we had 2 people. And our position was through distributors as the number 5th. Then I gave them a goal to be the number 3 to begin with, and they achieved it. This team, young team of Horiba India, they achieved it. Now, as you know, the Sysmex and TransAsia have divided, and we are almost near number 1 in the blood analyzers. Not everything, not the X-rays and everything, that's separate. But in the field we are doing, we're very close number 1, and we intend to stay there. It's an excellent question, and if you go around the world, which I do a lot, different people have different health systems. Even in US where I live, the healthcare system is not that good. It depends on how much money you make. Then you go to Canada, everybody gets the healthcare. England, everybody gets the health care. But we have to do a lot of work. Like I was in China last month, I visited a hospital. I was very disturbed to see for a Chinese type of government, healthcare is not reaching the poorest people. So we have a disparity, tremendous, even in India. And we need to work on that, how we can normalize it, reduce the cost per test so that we can serve the masses. So it's not in the great state in the world, to be honest with you. Furi Biomedical, we are, as I told you, we're building a 12-acre complex. It's being built right now in Nagpur, and it will have a capacity for us to serve for next 10 to 15 years. And if need be, we do more. We have invested in Hardwar, we invested in Pune, we're investing here. So it's going to be the biggest medical factory in India. And my intention is to make in India the instruments also, not only the reagents. We do reagents here. And actually, Amitabh Kant, he's the one who, you know Amitabh, I got him to Hardwar to introduce inaugurate our facility. Fadnavis, he came to for a Nagpur facility. Gadkari ji, he came to the Nagpur. So we are trying to do the best we can, but my personal goal is to reach to the masses at an affordable cost. But we have to make money to keep on investing. It's not going to be socialism. In your Economic Times, I had an article a few months back. I'm sure you must have read it, perhaps. I think it's very important to have manufacturing here. That's what I said last time, and I repeat that. We need to have the manufacturing in India. Not only manufacturing, but to have the supply chain. Because manufacturing alone, assembly is not the answer. Because what happens then, the labor for manufacturing is only 10%. You don't gain much. You have to develop the infrastructure from bottoms up.